Hi, it's Eleanor Hayes from BirthZang. I want to talk briefly about gestational diabetes in pregnancy. It's an extremely complex topic and one that I cannot cover and wouldn't want to cover. It's a really detailed subject that requires you to do your own research on that. I have included some links on the description of this video to guide you into some places that I think are really useful, and you will find some fantastic learning about gestational diabetes. And this video is just supposed to be a little overview to just give you a sense of what it is and what it means for you. So gestational diabetes is a type of diabetes that is diagnosed during pregnancy and is affected in your pregnancy only. So it's slightly different than a standard diabetes because it's only affecting you during pregnancy. What it consists of is a very similar thing to diabetes, but we call it gestational diabetes just simply because it's referring specifically to the pregnancy. So what is it? Effectively, and this is the very dumbed down version, it's about the way that your body processes glucose. So what happens is when you eat carbohydrates, your body transforms them into glucose, which is a type of sugar. And then there's a hormone in your body called insulin that's produced by your pancreas. And insulin helps to convert glucose into energy. So it's a really useful thing, and the insulin will respond to the amount of glucose in the blood. Now, what happens in gestational diabetes is that it's not working properly, and the insulin is not able to process the glucose into energy. And there's a couple of different reasons why that can happen, and I'm not going to get into that now. And quite often when you're diagnosed with gestational diabetes, they don't look at what's causing it, but they just look for the symptoms. So it's not always exactly clear what the cause is for any particular person. But the important thing is that the glucose is not being transformed into energy by the insulin. And so the glucose, the blood sugar increases in your body and the levels increase as you go through your pregnancy. And that's not a good thing. And it can cause problems for you and it can cause problems for your baby. So we need to manage it. There are some things that are risk factors for gestational diabetes. To be honest, it's quite it's not a really common thing. It's unclear exactly how many people it affects, but it's around 6% of pregnancies people have gestational diabetes. Now, the reason why it's difficult to put a very clear number on that is because the way that we measure gestational diabetes requires looking at the levels of glucose in the blood and then making a call as to what's too high and when we should start managing it. And so it's about labeling it, and there isn't a very clearly defined or clearly agreed level of blood sugar in the body that we all agree on is the right rate for being diagnosed with gestational diabetes, because it's a kind of a graph that goes up like this. So we have to kind of make a call, and different countries and different organizations will use different criteria, and so that figure of 6% can move up and down depending on what criteria you use. So it's not always a very straightforward thing to be able to pinpoint. There are some risk factors. We do know that if you have a BMI, body mass index, higher than 25, it does increase your risk by 2 to 3 times. So that might make your risk of gestational diabetes go up to around 12%. So it's not guaranteed that if you have a high BMI that you will get gestational diabetes, but it may be that you will be offered a test if your BMI is higher. Also, people who have low BMI can also get gestational diabetes. So it's not an absolute, but it is an understood risk factor. We also know that if you are over the age of 35, that also increases your risk slightly. And some people in ethnic groups mean that your risk factor is higher as well. So it's different depending on your ethnic background, and that's definitely something to look into. But just because you have any of these factors doesn't mean you're going to get it, but it does mean that when we look at people with gestational diabetes, we seem to see some patterns with people who have some of these factors. So if you have one or more than these risk factors, it could well be that you that your care provider, your midwife or obstetrician, is going to look more carefully at you and monitor you closely so that we can see whether or not that's happening. So what does it mean if you get diagnosed with gestational diabetes? It does cause some problems later on. And again, these are risk factors. They're not absolute. So so what I mean by that is that the risk of this happening does increase, but the risks are relatively small. So I don't want to throw statistics because they're confusing and don't give you the full story. So I urge you to go and look at some useful evidence-based articles and studies, and I will post a few links to some great sources that talk about the risks in terms that mean that you can understand the numbers with context. But certainly we do know that with gestational diabetes people, one of the biggest risk factors is that you're more likely to have a larger baby because the blood sugar levels in your body get higher, and also they get higher in your baby as well. And the result of that is that it can mean you can put on weight and your baby puts on weight. And it also means that the baby can put on weight in different parts of the body. This in itself isn't necessarily a problem. However, there are some other issues in labour and birth that are related to having a larger baby. So some of those risks are around having a shoulder dystocia, which is where your baby's head is delivered and then the shoulders kind of get stuck in the pelvis, and that is increased slightly with gestational diabetes, or with large babies, I should say. Gestational diabetes is also associated with a higher incidence of premature babies and also issues when your baby is already born, perhaps with jaundice, or perhaps your baby needing to stay in NICU. So we do know that gestational diabetes can cause problem, but of course it's very difficult to predict exactly what that will mean for you. So what generally tends to happen is that we will be monitoring you more closely, and perhaps it might change some of your decisions in your pregnancy. Now, if you are at risk of gestational diabetes, or if we think that that's going to that's being a problem for you, you'll be offered a test. And the way that again, there's variations in the test, but generally what we do is you're asked to fast, and then you're given a high glucose drink, and your blood sugar levels are measured at various points in that process, just to see how your body is processing the glucose. And you will be kind of issued a number which indicates the level of blood sugar in your body's bloodstream, and depending on what the criteria is in your area, you will be diagnosed with gestational diabetes. Now, if that happens, what can you expect? In many cases, you will be recommended to make some dietary changes. Remember, the blood sugar levels are directly related to carbohydrates, so it could well be that you're advised to reduce those and look and follow a particular diet. Again, something for you to look at and talk about with your midwife or doctor about what changes you can make in your diet to help manage the situation. We also sometimes, in cases where you have extremely high glucose levels, you may be asked to test your glucose levels at home. And if diet and other changes don't seem to be helping, and if your blood sugar levels seem to be continuing to rise, you may be offered some medication. And again, all of this will depend on your own personal situation, any other risk factors you have, any other things that are going on for you, the policies in your local area. There's so many factors, it's difficult to say exactly what would happen for you. So your midwife or doctor should talk you through what things that you can do. But the good news is that making changes to your diet can have a really positive impact. So that's really, really helpful and definitely something to investigate. So the other thing that tends to come up with gestational diabetes is the question about being induced before your due date. And the reason why this is offered is because in many cases, we know that people who have gestational diabetes often end up having bigger babies, and those babies can give you a higher risk of other birth complications. And so what tends to happen is an induction will be offered maybe at 38 or 39 or 40 weeks of pregnancy to try to enable you to birth your baby before they get too big and try to avoid some of those complications. However, having an induction of labour in itself has its own set of risks. And so with any decision with an intervention, it's always useful to read up on the subject of induction. And I cover that in my book, Helping Birth, which is sitting on my shelf behind me, Helping Birth, Your Guide to Pain Relief Choices and Interventions in Labour and Birth with Real Stories, available on Amazon. And induction is a really complex process which has many, many different stages. And it's very useful to understand what those stages are so that you can make a really good choice about whether you want to go with that. Having a big baby in itself is perfectly possible to have a natural delivery, because there are some other complications that can be associated with gestational diabetes. Sometimes we feel that we want to have an induction because it's going to be the best thing for us and for our baby, and that's absolutely fine. But it's always useful to be as informed as you can about anything that happens so that you can make the best choices and just know what's actually happening and what to expect, because that helps you to feel much more empowered in what's going on. So having what's defined as a big baby, macrosomia, meaning big baby, is defined as any baby over £8 13 ounces. Now I had two babies that were £9.8 and £9.3. I didn't have gestational diabetes. It is perfectly possible to have a large baby and have absolutely no issues. But there you go. It's one of the things that we have to consider when we are making our choices. There's a question as to whether or not induction absolutely has to be done. And when you look at some of the research on the subject, to be perfectly honest, there isn't clear evidence that having an induction of labour completely eliminates all of those risks. So again, it's useful to make your own research about whether or not doing an induction for gestational diabetes is the right thing for you to do. It's a personal choice, and I encourage you to use your brain and think about the benefits, risks, alternatives, implications, nothing, in order to be able to make the right choice for you. What's really important to understand is that gestational diabetes is absolutely a manageable condition, and it's a sliding scale. So just because you've got this level doesn't necessarily mean that everything's all going to pot. You're fine and your baby's fine. And the good news is when you're diagnosed with gestational diabetes that you're monitored really closely and your baby is monitored closely. And so we know that we're looking after you and giving you the best care that you possibly can and avoid any kind of issues and any complications. So it's absolutely not something to be worried about. There's some amazing articles, research and studies on the internet. And there's also support groups as well out there. And it's just a condition that you will need to monitor and manage. And the best way to do that is to inform yourself as best you can. So I hope this has given you a bit of an overview as to gestational diabetes, and that you kind of feel like you're armed with a bit of knowledge to go forwards and look at all of the other things that you need to do to inform yourself as best you can and make the best decisions for you and your baby. So please feel free to subscribe to my YouTube channel and be notified of new videos. I'm posting all the time about pregnancy conditions, sleeping conditions, stuff in pregnancy, stuff in labour and birth, all kinds of things. And if you have any kind of questions, please email me, eleanor@birthsang.co.uk, and I will endeavour to answer your question and post it to the channel. Thanks for listening. Bye.